When we talk about the journey of pregnancy, one of the most anticipated and anxious stages for many women is the so-called 2-week wait, which refers to the time from ovulation until it is possible to know whether conception has occurred. During this time, the female body undergoes subtle and complex changes that are often difficult to recognize. Therefore, understanding the processes of fertilization and implantation helps us gain a more accurate perspective about the earliest possibility of pregnancy, while also reducing unnecessary worries and learning how to care for the body in a scientific way to begin. We must remember that the entire process starts with ovulation in the ovary. Each month, a group of follicles is stimulated to grow under the influence of follicle-stimulating hormone FSH, secreted by the pituitary gland. Among these follicles, only one becomes dominant and matures. Then the brain signals a surge of luteinizing hormone LH, which triggers ovulation when the follicle ruptures. The egg is released and must be captured by the fallopian tube, since the ovary and the tube are not directly attached at this point. The egg survives only about 24 hours, so fertilization can occur only if sperm are present in the tube. Fertilization is the union of genetic material from egg and sperm, creating a zygote which marks the beginning of new life. After fertilization, the zygote begins its journey down the fallopian tube toward the uterus, while dividing continuously from 2 cells to 4 to 8 in around day 3 after ovulation. It reaches the morula stage with about 8 to 10 cells by day 5 or 6. The embryo has developed into a blastocyst containing more than 200 cells. The blastocyst has an outer layer called the trophectoderm that will form the placenta and an inner cell mass that will become the fetus. This stage is crucial because the embryo enters the uterine cavity and seeks a site for implantation. Implantation usually happens between day 7 and day 9, after ovulation. At this point, the blastocyst attaches to the endometrium, which has been prepared under the influence of progesterone. Progesterone is secreted by the corpus luteum, which is the structure left behind after ovulation. Its role is essential to transform and stabilize the uterine lining so that implantation can occur without progesterone. Implantation cannot happen when the embryo implants. It begins to release human chorionic gonadotropin HCG. This hormone maintains the corpus luteum to keep producing progesterone, thereby preserving the uterine lining. HCG is also the hormone detected by pregnancy tests. Thus, before implantation, the body produces no HCG, so pregnancy tests will always be negative. The earliest a highly sensitive test may detect pregnancy is around day 8 or 9 after ovulation. Many women during this period may notice signs such as breast tenderness, heightened sense of smell, mild nausea, bloating, fatigue, or even light spotting caused by the embryo burrowing into the uterine wall. However, these symptoms can be easily confused with normal luteal phase symptoms, since progesterone naturally rises even in non-pregnant cycles. Therefore, subjective feelings alone are not reliable for confirming pregnancy. Scientifically, only HCG provides objective evidence in assisted reproduction, such as in vitro fertilization. Doctors may transfer embryos into the uterus on day 3 or day 5. If transferred on day 3, the embryo still needs time to reach the blastocyst stage before implanting, whereas a day 5 transfer places the embryo at the exact stage it would normally enter the uterus, whether natural or assisted. The biological principles remain the same. Hormones in uterine preparation are the key. When it comes to early pregnancy signs, we should understand that besides breast tenderness, nausea, food aversions, fatigue, or heightened smell, there may also be emotional and psychological changes such as irritability, insomnia, or anxiety, all strongly influenced by progesterone and HCG fluctuations. Many women find this phase challenging as hope and worry coexist. Therefore, comprehensive self-care during the 2-week wait is extremely important regarding nutrition. Women should maintain a balanced diet rich in fiber, vitamins, and minerals, especially folic acid, iron, calcium, and omega-3 unhealthy fast food. Saturated fats, alcohol, and excess caffeine should be minimized as they may interfere with implantation. It is recommended to eat a variety of green vegetables, fresh fruits, whole grains, and ensure adequate protein intake from fish, lean meat, eggs, and legumes. Regarding rest, women should prioritize 7 to 8 hours of sleep each night. Avoid staying up late since sleep helps regulate hormones and restore energy. Light physical activities such as walking, yoga, or meditation are beneficial for circulation and reducing stress for mental care. It is important to reduce anxiety by sharing feelings with a partner or trusted family member. Avoid consuming excessive negative information online, and consider journaling emotions daily as a way to self-reflect and release tension. Prolonged stress can disrupt hormone balance and potentially reduce fertility. Therefore, nurturing mental health is just as important as nutrition and rest. It should also be emphasized that some women may experience no noticeable symptoms during the 2-week wait, yet still achieve healthy pregnancies, while others may feel many signs but end up with a negative result. This does not mean there is a problem with the body, but simply that individual responses vary. A common question is why doctors calculate gestational age from the first day of the last menstrual period, rather than from fertilization. The reason is historical before ultrasound and hormonal assays. The only reliable marker was the onset of menstruation. On average, ovulation occurs about 2 weeks later. So when fertilization takes place, the pregnancy is already considered 2 weeks old. This standard allows consistency in clinical practice, even though the true embryonic age is younger. If you know your exact ovulation day or embryo transfer day, that is biologically more accurate, but clinically, the last menstrual period remains the convention. In conclusion, the 2-week wait after ovulation or embryo transfer is a stage filled with both tension and hope. Understanding the biological mechanisms of ovulation, fertilization, implantation, the roles of hormones and early pregnancy signs can help you monitor your body more accurately. When combined with healthy nutrition, proper rest, and positive mental care, you can both optimize your chances of success and protect your overall well-being. If you find these insights helpful, please leave a comment to share your thoughts. Do not forget to like, subscribe to the channel, and share this video so that more people can access reliable scientific knowledge about reproductive health